Alaga Health is the Philippines' first digital health marketplace and health service hub, bringing you healthcare anytime, anywhere, in every way. Alaga Health recently just won third place at the Arise Boost Accelerator Demo Day, co-implemented by IdeaSpace Philippines, QBO Innovation Hub, the Department of Trade and Industry, and the International Trade Center. Dexter Galban is the CEO and co-founder at Alaga Health. So hello, Doc Dex. We're very happy and honored to have you dito sa Startup Podcast.
Hello, Johnny. It's a pleasure to be here. And to all of our listeners, thank you for once again joining this show. And hopefully, you'll be encouraged to become a part of the startup community in the Philippines.
Yes, we're very happy, Doc Dex, to have you here. I've seen Alaga Health from last year and napakabilis ng growth ng Alaga Health. So maybe we can know more about that story and maybe you can share some advice also to our listeners kung paano ba mag-grow ang isang social enterprise ng ganun kabilis. But let's start with the first question. No? So ano ba muna ang Alaga Health?
Yes. So Alaga Health, as you've mentioned, is the Philippines' first universal digital health marketplace and health service hub or health service aggregator that allows both patients and health providers, so that includes your doctors, nurses, psychologists, among others, to access and provide, so two dynamics, health services ranging from your telehealth to in-person health services, even your laboratory care, amongst others, all within a unified mobile and web platform. To make it simple, basically, we are your everything, anything health platform so that kapag may kailangan ka tungkol sa iyong kalusugan, alam mo merong mag-aalaga sa iyo.
Yeah, so it's basically all in one, no? Lahat na may kinalaman sa ating kalusugan, lahat na may kinalaman sa ating health, or basically the whole healthcare industry, nandun sa marketplace, nandun sa app actually, lahat ng pwedeng, lahat basically ng kailangan natin. Let's start first with the digital part, kasi Alaga Health nga is the Philippines' first digital health marketplace. Pero ano ba muna ang advantage ng pagiging digital? How crucial or important is it to make health services digital, kumbaga? Or yung access, kumbaga?
That's true, because there are a lot of benefits when it comes to going digital. And actually, government is trying to ensure that we really invest in the digitalization process because it helps make things more efficient. And one of the things that we saw that was lagging was investment in terms of health tech. Bakit? Kasi kalimitan, since it's very manual in terms of the process, mahaba yung pila, mabagal yung processing, people are buried in administrative work, that the actual care part, medyo lumiliit yung time spent on that. And at the same time, it allows us to free up our health personnel from doing administrative work or things that are going to block their capability na talaga makapag-render ng health service. Plus, it will allow everyone to have access to the right information. Because one of the first things that they would ask, especially if they're not feeling well, may nidinaramdam sila, may pakiramdam silang hindi maganda, ang una nilang tatanong, may kakilala ka ba? Sino ba yung kakilala mo? Yung mabait, yung mura, yung magaling, yung malapit. Those are the considerations always. But we do not have a readily available platform that will help aggregate all of these health services and even the information about these services. So that's how Alaga Health really came into the picture, hoping to provide a way to not only empower health providers to render additional service and have another avenue for income, but at the same time, it also empowers a lot of people to become more discerning. Now they can pick and choose ano nga ba yung gusto nila, malapit, mura, mabait, magaling, among many other considerations, all at their convenience.
Yeah, those are really amazing explanations, like gaano nga ba kalaki yung advantage ng pagiging digital. Like for example lang, like maybe if I have, for example, may sakit ako or meron akong dinadamdam or may naramdaman akong masama or something, imbes na pupunta pa ako sa hospital mismo or sa clinic kasi nga yun lang yung alam kong pupuntahan, pwedeng i-check ko muna sa website or sa app at mako-compare ko nga yung mga different maybe sino ba yung aling clinic ba or hospital ba yung may ganitong specializations, or maybe some financial concerns, and maybe when I go to the clinic baka pipila pa ako and nanay pang nakaka-stress pa, madagdagan pa yung yung nararamdaman ko. So I think I really agree na ang laki nga ng ng advantage or ng benefit ng pagiging digital. Pero let me ask you, Doc Dex, kasi you're a doctor, ano, parang meron bang hugot to or meron bang story na nagpasimula ng parang, I mean, why really did you want to solve this problem, like building Alaga Health's digital health marketplace?
Sure. Probably we can go all the way back when I was much younger. We're in my family lost my grandmother because we are unable to easily find affordable quality home healthcare. Not knowing that after she passed, we found out very recently after that there were nurses actively searching for work. So it was our lack of awareness and knowledge that there are health professionals or health workers that are available actively looking for work that can render and help our fellow Filipinos when it comes to healthcare. So that was a major starting point. And then I underwent my training. I'm also a nurse. And every day when I was going through nursing school, I was always exposed to the image na pag pumupunta akong klase o kaya naman papuntang duty, as early as 4 a.m., ang haba na ng pila sa labas ng ospital with some patients coming from different parts of the Philippines. Yung iba hawak-hawak pa nila yung swero nila nakasabit sa puno, all hoping for a chance na makita sila ng isang health professional because ang takot nila ma-cut off o hindi na sila ma-accommodate or puno na among many others. And then this persisted for years up to the point that I was already the one behind the consultation table. When I was training as a young doctor in a public hospital, I personally saw how some patients would wait up to 10 hours for just 10 minutes worth of medical consultation. Ibig sabihin yung consultant nila, magti-tweak lang tayo ng konting dosing ng gamot o kaya naman magti-tweak lang tayo ng management intervention na pwede sanang nagawa virtually. But they waited the whole day, they spent money, nagumasto sila sa pagkain, sa travel nila, and then they missed the chance to earn. Plus, napalayo pa sila sa pamilya nila with some going to hospitals or health facilities na sobrang layo kung saan sila nakatira kasi dun lang sa lugar na yun merong this particular specialization o kaya naman dun yung may kakilala or whatnot. Ang daming factors. And that's not how healthcare should be because we should enable every single Filipino to access healthcare affordably and with good quality. Because at the end of the day, healthcare is a right of every Filipino that we definitely will be championing and are championing in Alaga Health.
Yeah, definitely providing healthcare access nga no, to everyone. Dapat pantay-pantay yung access man lang natin. Very visual no yung example with that yung andun pa yung swero no sa patient na gusto magpagamot or magpunta sa doctor. And maybe nga no when someone parang pag critical na yung condition no kaysa pipila pa or kaysa ang dami pang taong kailangan pagdaanan kumbaga with digital mas mabilis no, so somehow it can make healthcare service more faster and efficient. What are the services ba no na nasa Alaga Health marketplace, and meron ba limits ba sa pagiging digital? Like for example, I can imagine hindi naman lahat ng healthcare service pwedeng magawa digitally, so can you just share some thoughts on this?
In terms of services, our top rollout is still telehealth. Why? Because in light of the pandemic, it was one of the things that we wanted to push because it was one of the things that were needed dahil maraming takot pumunta ng ospital. The thing is, especially during the height of the COVID-19 pandemic, hindi naman ibig sabihin na meron tayong global pandemic at nakafocus sa COVID-19 na lahat ng ibang sakit na wala na. They still exist. Meron pa rin may heart condition, merong lung problem, meron mga kailangan magpa-check for the reproductive health, may endo problem, diabetes, among many things. These conditions still exist and kailangan nilang mabigyan ng atensyon. And this allows us to render service even outside the bounds of the hospital. But here's the thing. We do know and we actually welcome na maraming biglang lumabas na telehealth companies, na mga digital health services. I find those to be absolutely good and well because it allows the Filipino community to become more accepting of digital health. Because it was a good way para ma-unclog natin yung mga health centers, magkaroon tayo ng access and chance to choose the best services that are available. That is why even during that time, we decided to look and survey the entire sector to see what will make us different. And our approach is that instead of establishing different companies focusing on a single strand, for example, telehealth or home care lang, or probably laboratory lang, instead, let's provide a mechanism that will allow us to aggregate all of them for them to see that from the ground up, instead of different companies biglang nag-merge, so hiwa-hiwalay sila ng mga sistema, iba-iba ng mga proseso, we wanted to build one from the ground up that is fully based on, nakaayon siya sa pangangailangan ng mga taong sa palagay nila ay kumbaga nakalimutan o kaya naman are part of the gaps. Kaya most of the time, Alaga Health works with a lot of patient organizations, NGOs, non-profits, MSMEs. So yung mga problema nila yung ina-address namin because as a small enterprise that's hopefully going to continue growing, our intention really is to address those that are not being addressed by anyone else. So, kaya ang ginawa namin, nag-focus kami sa pagkakakabit-kabit ng iba't ibang systems. For example, nag-telehealth ka, pero kailangan mo rin pala mag-face-to-face, iba to ka kaagad na mag-schedule siya within the same system. Ay, wait, kailangan mo rin pala mag-lab, madaling mag-refer. So, we're trying to create an ecosystem or at least a microcosm of our idealized healthcare system na kapag anong kailangan mo, makukuha mo all conveniently and hopefully more affordably.
Yeah, that's really amazing, ano. So mas madali nga na it's true, no, na different clinics, different healthcare service providers magkakaiba minsan ng company or ng system. So maganda nga na when someone na may sakit, through Alaga Health, andun na lahat ng pupuntahan niya. Andun na yung flow, kumbaga. Andun na yung structure, yung system nung pagdadaanan niya. I'm going to the marketplace part, no, or the aggregator part. So paano ba nag-work ito? Like on the marketplace side, like on the clinics and the healthcare service provider side. Like parang do you onboard them ba? I mean, like pag pinuntahan ba yung app, andun ba naka-display lahat ng mga clinics, lahat ng mga providers? So how does this work?
Yes, there are two systems because we currently have two releases. We have one that's readily available, public, as in you can download it online. Then we also have one that's localized, that's primarily being rolled out in specific locations, LGUs, companies, etc. So, ang approach talaga doon is that hopefully in the future, especially pag kaya na ng bandwidth, especially maraming simultaneous things na nangyayari, we'll be able to merge everything together all in just one system. Pero ang approach niya talaga is we do not employ any health professional directly because our goal is to help facilitate how they practice their profession. So whether you're a doctor, a nurse, a registered nutritionist, and probably dietitian, psychologist, or any other health professional, occupational therapist, physical therapist, yung mga health professions na minsan nakakalimutan natin that exist but play a major role na hindi lang sila pinupuntahan kasi ang automatic na iniisip ng mga tao. Pag may sakit ako, doktor. O pag may kailangan akong inumin na gamot, pharmacist only. Ang dami, you can consult the entire spectrum of health professionals that we have. We allow them to be onboarded to the platform at no cost. Once they become onboarded, automatically they have their dashboard. They are able to use the telehealth feature of the platform. They have their own clinic manager if they want at no expense. Why? For context, especially in the private sector, para makapagtayo ka ng isang clinic within the confines of, let's say, a medical institution or medical tower or whatnot, you would need to spend millions just to get that slot. Kasi maganda yung traffic to the location and of course excluding pa yung renovation among and many other things. So we wanted to take away all of those unnecessary things and give you access para pag gusto mo mag-practice ng profession mo, napakadali. And at the same time, kasi coming from a nursing background also, I see a lot of nurses wanting to have additional income apart from their work in government or private, which is not disallowed naman. So makapag-insert sila ng ID, especially for home care, o kaya naman makapag-health education sila. We're giving them the platform to do so. Kasi one of the biggest issues ng nursing community natin, actually all health professions, is that they find that there are limited opportunities for growth and revenue here. So one of the things that we do is to give them a reason to stay and to adjunct kung ano pa yung kailangan nilang income na flexi. Kunyari, after work, edi I take on probably a home care check-in with someone that I will pass by na malapit sa bahay. So, it allows them that flexibility to practice their profession. And also, in terms of continuity of care, mas maganda. Kasi usually, alam, especially ng mga madalas pupunta sa mga doktor nila na long-term, Pag magka-consult sila, ay, nagbakasyon si Doc, ilipat natin sa kung kanino na iba naman. So, pwedeng ayon, they now have the option. They can still do that if that's their preference. Pero they also now have the option na, ay, nag-abroad si Doc. Pero ang kailangan ko lang naman, mag-a-adjust lang kami ng dose. I can conduct telemedicine even if they're abroad, amongst other things. So, also, to add to that, kasi our focus really now is more on the international community. When we were brought to Switzerland as part of our company showcase, because we were invited by the World Intellectual Property Organization, tsaka yung IFPMA, to talk about our startup and our progress. One of the things that we noted, especially in our travels, is that a lot of Filipinos abroad are actively looking for that touch of Filipino care. Iba daw kasi talaga kapag kausap mo yung kapwa mo Pilipino, na kapag Tagalog kayo, nag-uusap kayo, damang-dama mo, in contrast to those that are seeking assistance. Not saying that they have a bad healthcare system, pero iba daw talaga yung, especially pag nasa ibang bansa ka, nakakausap ka na, uy, kabayan! Yan, yung feeling na, uy, kapag ako Pilipino to, parang ang galing mo, parang gusto makapag-chismisan na lang tuloy. To the point na the trust and confidence is more readily provided. So that is one of the reasons why we firmly believe in the power of digitalization plus the notion of a marketplace. This will actually help push prices down dahil ang mangyayari dito, kapag mahal ka masyadong maningil at hindi maganda yung serbisyo mo, more likely than not, you will not get more clients. In contrast to those that will appropriately, I'm not saying they're super cheap, but appropriately and consummately price their services at maganda yung render ng service, kahit mayat-maya, meron kang pasyente. It's also a way to elevate the quality of healthcare provided while simultaneously pushing down the price. So that's the approach that Alaga Health follows.
Yeah, I'm really amazed. I'm really amazed at all of those things na of how you explain. Kasi Alaga Health as a startup or as a social enterprise, napakalaming facets ng healthcare na natatakel niya and maybe nasa-solve niya na hindi nga natin alam behind. Parang, I really like that part, no, na somehow it can prevent the brain drain or parang yung pag-alis sa Pilipinas ng mga nurses and doctors natin. Kasi when we have technology that gives more power, that empowers them na magstay dito sa Pilipinas, maaaring andito talaga yung opportunities. Andito yung, kumbaga, they will stay here and then we can help more Filipinos. So, I think Alaga Health, no, as a marketplace is also serving that kind of, solving that kind of problem, that aspect sa healthcare provision. And basically, I really like that completeness, kumbaga, ng approach ni Alaga Health. On the user side naman, parang how what really is the picture for someone who will use the app para lang makita, maybe meron tayong mga listeners na interested to use, to be a user of Alaga Health. So can you just share kung gaano nga ba talaga kadali at ka-convenient gamitin yung web and mobile app?
Yan. So napakadali lang yan. It's as simple as ABC. Literally ABC. A, download the app. App lang. Download the app. Second, book your service of choice. And 3, C, get the care that you need. Ganun lang siya kabilis. So once you register, you'll be able to download the application, and then once you open the platform, you can pick and choose. Ang hanap mo ba telehealth? Ang hanap mo ba home care? Ang hanap mo ba laboratory? Ang hanap mo ba face-to-face consultation na booking? Then you select. Then depende sa availability, because this will be primarily location-based, availability-based. So hopefully, merong available ng health professional in your area. Kung wala pa, please encourage your favorite doctor or nurse or health professional to sign up as a health provider in Alaga Health para they are able to reach more people. Kasi yun naman talaga yung gusto natin para ma-prevent yung incidences. Kagaya na nangyari sa family namin before, na not knowing that just a couple of blocks away, there were health professionals actively looking for work na hindi namin alam that they could have helped take care of the people that we love. Kasi nga, ang lagi kong sinasabi, everyone knows what it's like to love someone. And one of the hardest things to do is to say goodbye to that loved one too soon. And what we want to do is that we want to ensure na madali mo ma-access yung health services para you're always comforted by the fact that you did the very best that you can all the time for the people that matter.
Yeah, at saka ang ganda ng name, no, Alaga Health. Yung alaga talaga, yung mentioned nga earlier, no, yung about sa Filipinos abroad na naghahanap ng Filipino doctor or nurse. Kasi iba nga talaga pag when you hear those words, kasi sometimes, I mean, it's part of healthcare, no? Yung words, yung comfort na you feel at home. Parang you really feel na nahihil ka or gumagaling ka. So, I really like the name, no? Alaga. Kasi andun talaga yung parang, yun talaga yung word na kumbaga, nag-encompass ng lahat ng ginagawa ninyo. So, punta naman tayo sa stories behind Alaga Health. I'm really interested in this. You have a medical background nga, no, Doc Dex. But can you just share parang, how was the transition to becoming a startup founder? I mean, I'm imagining it's not that easy. I mean, like to from a medical background and then going and then starting a startup, especially a social enterprise. So can you just share some experiences and some perspectives on this journey?
Sure. Here's the thing. You will rarely find people from my background doing this because usually, especially if you're in the medical field or any health profession, it's relatively more lucrative kung dito ka na lang, kung mag-practice ka ng profession mo, tingin ka ng pasyente, amongst others. But for the longest time, my area of interest talaga are systems development, program development, policy making, and at the same time, business development. And I wanted to really apply all of those para makita natin kung paano natin ma-resolve yung mga problema na matagal nang nandyan, pero ang ibang klase yung approach na kailangan. So why not? And this is actually quite daunting because this is out of left field. Although I did take also my MBA alongside my MD degree, it's still a very daunting process to stay out and go out actively of my comfort zone to really try to address and provide a solution to things that I've seen on the ground talaga. So at the same time, I also studied again Masters in Public Management to now see how we can better improve the healthcare system by bridging the private sector initiatives with what government is doing. Kasi at the end of the day, ang gusto naman natin, it's supposed to be health for all. Hindi lang health para sa mga may pera, hindi lang health para sa may kakilala sa gobyerno. It's supposed to be health for all. So that's the reason why I really wanted to take a chance and see what we can build, what we can do. Whether we succeed or not, at the very least, we did our best or exerted our best effort to make it happen, and hopefully we will succeed so that we can help adjunct any gaps that are present when it comes to healthcare service delivery. Kasi iba rin talaga, especially when you hear stories of nurses, doctors migrating abroad because they do not feel that there are a lot of opportunities for them here, not only to practice their profession, but to build their families amongst others. Yet at the same time, we hear concerns na lack of manpower, kulang ang doktor, kulang ang nurse, or probably the proper term would be maldistribution. Kasi everyone wants to go to the metro. What about our regional areas, our provinces that are also in need of these specialists, of these doctors, nurses, amongst others, na may kakayahan dapat na makatulong sa ating mga kababayan. So this is why we wanted to introduce this. We are absolutely nothing compared to the big institutional players that have a massive war chest. No, we are small. We're very small, but hopefully we will continue to grow. Why? Because our approach, even up to now, we have been fully community funded. All of our funding, apart from, of course, the personal savings that we used to start, all came from grants, from hackathon wins, from competition prizes, all of them really geared so that we can prioritize what to spend on and to really focus on the things that the community needs and wants. So hopefully, we will get the continued support of all of our partners, especially mga nonprofits, patient organizations, kasi we were designed from bottom up with them in mind. Mismong sa design ng application, we had to look into, ito ba yung tapang font size? Paano pag si Lola ang gumamit? Paano pag medyong disability yung gagamit? We have to make it so easy to use that when they try to work it out, madali for them. So truly, from the design to the execution to even partner development, ang nakasentro talaga mga kababayan natin.
Yeah, I agree. No, it's really a noble effort now what you're doing, Doc Dex, and with the whole team sa Alaga Health. Kasi it's true na being a social enterprise, parang naka-root talaga sa pangangailangan ng mga Pilipino, ng mga tao yung ginagawa ninyo. Compared with, like, for example, when it's a healthcare provider na medyo private on the like medyo profit oriented kumbaga, no. Parang somehow magkaiba yung approach eh. So I really like that approach, no, na really, I mean, providing for the marginalized, providing for those in the regional areas, and especially yun nga, as what you mentioned, na one of the reasons then why we have why we have this podcast and even startups sa Pilipinas, why we're empowering startups sa Pilipinas to really have jobs and careers here. So sana nga yung mga doctors and nurses natin ay magstay na lang sa ating sariling bansa. Anyway, no, so continuing your journey, I really like Alaga Health journey kasi it's very community driven nga and parang from the ground talaga. So you've joined nga many incubator and accelerator programs and even competition. So can you just share parang ano ba talaga yung nagda-drive sa inyo to go forward and yeah, to build Alaga Health?
In terms of drive, really yung mga personal experience. If you would even look back at the way that we recruit and invite people to join, we're open to working with anyone and everyone. Because the skill sets, of course, may mga key skills na kailangan, especially for tech, because tech is very specialized and it's also very expensive. So really, one of the things that we look for above the skill would be the reason for being. Why do you want to join? We tell them upfront, why do you want to join a startup wherein you can be earning so much more elsewhere? You can be doing so many other things, but why join a startup? If you want to get rich fast, this isn't the place for you. But if you want to help us build something, if you want to help create a solution, then let's work on it together. And that's why we really love it when it's our team na talagang humuhugot from their own personal experiences. Probably a family member within their family experienced difficulties accessing healthcare, or they themselves are having difficulties managing their healthcare because of possible gaps. So we really look more into the purpose of everyone else when it comes to joining the team. Because again, we tell them if this is perceived to be a get rich quick kind of scheme, this isn't the place to go. Because really, our intent here is long term. And whether it takes 1 year, 2 years, 10 years, 20 years or so, we will keep going in any way that we can. We will go where we're needed. It might be necessary for us to pivot in the future or probably hyper niche. It really doesn't matter. But matters is we will do our part towards improving healthcare access for all.
Yeah, it's really different though when your startup is really purpose driven. Kumbaga, that's really a mission. Speaking of those programs no, and competitions lang that Alaga Health has been conquering or parang you've been winning a lot of these competitions eh. So recently, actually last month lang no, Alaga Health won third place at the Arise Boost Accelerator Demo Day. So, can we know muna yung experience in this program and maybe parang how do you think did you win the Demo Day? I mean, parang ano ba yung naging pitch ninyo, especially you're a social enterprise ano. So, parang how did you I mean, what do you think made you won this Demo Day?
First and foremost, I'd like to thank the Arise plus Boost Accelerator for the opportunity to be part of the program because it was a concerted effort not only by our international partners but also by the Philippine government through DTI amongst others, and of course QBO and IdeaSpace. But in terms of being able to provide a definitive answer as to why we won, I really don't know. Because the truth of the matter is, whenever we join competitions, whenever we join hackathons, any pitch endeavors, it's really more about sharing our story and what we've done. And our goal, of course, at the end of the day, is it would be nice if we would get additional support. But above all else, we were actually being courted by one institution, offering us a partnership with funding amongst others. But one of the things that we told them is, apart from funding, what we need more is a partner or our partners. Because although this sounds weird coming from a startup, at the end of the day, money is easy to find. Particularly, there's so many ways to fundraise, so many ways to get easy access to funding. You can loan, you can fundraise, equity fundraising, amongst others. But at the end of the day, what really matters more is, beyond the funding, we need partners who are actually going to believe in the purpose of the company, believe in the purpose of the social enterprise, and actually assist us in terms of ensuring that yung goal ng startup will actually be achieved. More important than any kind of profit or margin that happens year on year. Because at the end of the day, you always have to ask ourselves, once we've done all of our work trying to picks up the system, the digital aspect, the sales, marketing, etc., we would ask ourselves, are we happy? Did we do our job? And were we really able to help people? Because this is what sets social enterprises apart from your usual businesses. Not saying that they're bad, but this one has a little bit an extra level of criteria that's looked upon. More so that you don't only look at your profit year on year, or how much did you earn, or what did you do, but also really look into the impact that you've been able to create. Were you able to reduce waiting times? Were you able to provide healthcare to those who typically would not have access to healthcare? Were you able to drive the prices of things down? Were you able to give job opportunities to those who wanted extra income? Were you able to highlight the other professions na nakakalimutan that are there that have a huge role to play? Your occupational therapist, your speech therapist, your physical therapists, among others, that they all have a role to play. Because at the end of the discussion, health is everyone's business. We're just helping facilitate it.
Yeah, amazing, amazing. Actually, yung objectives nga ng isang social enterprise is not really sometimes yung revenues or yung profits, but really, did we solve this problem? I think that's the bottom line of it. Yeah, so for our final question, Doc Dex, this is a really wonderful conversation, no? We just really want to know, ano ba ang vision ni Alaga Health like in the long run, ayun nga, in the 10 years, para ano ba talaga yung gusto makita ni Alaga Health and even you, the founders, in the long run for the Philippines?
Yeah, so in terms of our vision for Alaga Health, we want to be your everything everyday health application, particularly so that you can ensure that you can find a digital hospital, a community, and a health marketplace in every device. And all of these efforts are intended to ensure na bawat Pilipino kayang makaramdam ng pag-aalaga, not only by their fellow citizens but also by their companies, especially if it's through MSMEs, by their government, especially if it's through their LGUs or government agencies, and their community, more so it's coming from their patient organizations or nonprofits. Because again, everyone wants to get better. And our team, our call sign in Alaga Health, it's always getting better together. So we invite everyone to hopefully join us, whether as a partner, a client, a health provider, amongst others. And let's help every Filipino get better together. Because at the end of the day, healthcare is everyone's business. Healthcare anytime, anywhere, in every way.
Yeah, sana nga so pag meron tayong dinadamdam or pag nararamdaman or pag may sakit tayo, basically we just look at our phones and then andun na ma-access na natin kung ano man yung kailangan natin. Yeah, so thank you, Doc Dex. If our listeners want to download the app or they want to know more about Alaga Health, so where can they get more information, where they can download, so you can just invite them.
Sure. Please visit our website at www.alagahealth.com. You can also check out our Facebook page at facebook.com/alagahealth. And of course, download our application, especially in iOS, the Play Store, as well as our app stores. You can avail it both in Android and iOS. So whether you're using either of the device, madaling yung ma-access siya. Plus, we also have a web platform for our health professionals para mas madaling yung pong ma-manage yung ating patient role. But at the end of the day, we hope that you will keep in touch. Hopefully, we can work together and let's truly work together towards health for all and ensure na hindi magiging mahal ang pagmamahal.
Yeah, and for sure marami pa tayong aabangan with Alaga Health. So maraming salamat, Doc Dex. This is a really wonderful conversation. Really knowing about Alaga Health and what you're doing as a social enterprise and yung mission ninyo. So maraming salamat.
Thank you so much. And again, to all of the listeners of this wonderful podcast, looking forward to hopefully reaching out to all of you soon. And hopefully you can continue listening to this show for future episodes. Let's learn more about the startup community and let's empower all Filipinos.
Thank you very much to our 21 patrons. AskLex PH is our official e-learning partner. Get 5% discount on e-learning courses and certification programs on Lean Six Sigma, project management, data science, and many more using our promo code ALPHAXSUP. This episode is super powered by NutriCoach, the all-in-one productivity tool for dietitians and nutritionists. Looking for buy and sell online with Sigurado sellers. Benjoy's Food Products, the home of premium bacon ends, tapa, and tocino. And 8Chain, an 8-in-1 cryptocurrency project building one chain at a time, starting with max rep, workout, and earn. This episode is powered by ePlayment, Interleukin, and ROC.ph. Support us at www.patreon.com/startuppodcastph.